And so once again, thank you, Ms. Lemus, for making the time and being with us here on KBBF 89.1 FM and on the web at kbbf.org in your show, Lideres del Futuro. We've been doing this for several months, and then your colleague, Melissa, used to be here for a few months before that. But what can you tell us? This is our update on what's going on with COVID in Sonoma County. What can you tell us about the numbers? Because the numbers are very important in being able to open more businesses, being able to open the schools, so on and so forth. What can you tell us today?
Yes, thank you, Rafael, for having me today. We now have a total of 27,864 confirmed cases, which is an increase of 61 cases in the last 24 hours. Unfortunately, we have lost up to date 295 people have died of COVID. So I'm very sad for the community. We continue with testing, and we have completed now a total of 123,609 vaccines, with 2,500 in the last 24 hours. And that's now like 20% of our population here in Sonoma County. And the other metrics, because we still are in a purple tier, which is based on the California Blueprint for a Safer Economy, which just amazes the metrics that guides our opening and the tiers that we're in. We're currently, our rate of new daily cases per 100,000 population is 14. It needs to be less than 7 for us to be able to move into the red tier, which is less restrictive. Our testing positivity rate is at 4.6%. It needs to be less than 8 for us to move to the next tier, so that's a good number. Our equity metric, testing positivity rate is 7.7. Again, it needs to be below 8 for us to be able to move. So it's looking good, but the daily new case rate is just keeping us from moving to the next tier. But at the same time, a really important factor of that is testing. And we know that we're doing less testing, and there's a lot of different reasons for that. I think one of the reasons is because in October, November, when we did a lot of testing, we did a big push. And a lot of our hospital staff, our people that work in health, were getting testing on a regular basis. And so that was increasing it. But now people are more complacent, and I think people are tired, and the vaccine is here. So it could be kind of people are just kind of not thinking that much about testing, but it's really affecting, and we're getting penalized from the state because they use our testing numbers, how much testing we do, as a factor in determining our new daily case rate. And so we can't get that adjusted to a lower amount unless we do more than the state average of testing. So we need to really increase testing. And I'm going to talk a little bit later too about how, I can share that now, about the vaccines, how there was a meeting this week with a lot of the county leaders and the governor, how they want to really use our vaccine rates that we use, how much vaccines we do, as a factor in the metrics and bringing down those numbers, because they're not using it as a factor. And for example, Sonoma County, we're doing a lot of testing compared to other similar sized, not a lot of vaccines compared to other similar sized counties. So we want to make sure that they use that as a factor too, because that could help us.
Definitely. And again, that's important for us to keep in mind. Something that I think it's important to keep reminding people is, yes, the vaccine is here, but the rest of the people, we all need to get tested on a regular basis. And I think that the numbers have gone down, not so much because we are taking care of ourselves better, but because we are simply not going to get tested. And so it's important to remind every week, every time we have the opportunity, to remind people to get tested. Again, can you remind us where can they call to schedule an appointment? And at the same time, can you remind us, is it free, or is there a specific cost for this?
Oh, yes, of course. So we have a lot of options throughout the whole county for testing. So we, remind people that if you have like your own clinic or your doctor, to check with them first. But otherwise, the county has a lot of different options. If they go on socoemergency.org, there's a get tested button there that they can click on. That'll show them like a calendar with all the different locations and links on how to sign up. So they can also call our testing hotline, which is 565-4667. And just today's Thursday, just to remind people, tomorrow, Friday, there's testing at Andy's Unity Park from 9 to 4, and also at Bears Farm tomorrow from 2 to 4. And I think that's also along with the food giveaway tomorrow. So that's also happening. So it's really important, especially because a lot of asymptomatic that people don't know. There's a lot of that happening. That's why we continue to have a lot more, contagion in the community.
Definitely. And that takes us to the vaccine. We know that we are hoping that eventually 500,000 people, which is the population of Sonoma County, will get vaccinated, whether it is with Pfizer, whether it is with Moderna, maybe Johnson & Johnson is coming out soon. their
Mhm.
numbers were a little bit lower in regards to, Pfizer is like 95% effective, and so
Mhm.
is Moderna. But Johnson and Johnson, I think, is at 72%, which is still better than the flu vaccine. But
Mhm.
again, hopefully soon we'll have more options and a higher number of doses. Can you
Mhm.
tell us, let's start with something simple, and that is, how many people have gotten the first vaccine and how
Mhm.
many people have gotten the second vaccine? And
Mhm.
are we, in fact, getting more vaccines in Sonoma County?
Yes, so actually, then we have around 67,000 people that have received their first dose, and we have about 28, almost 30,000 people that have finished both doses. They've gotten the first and the second dose. So altogether, we've administered about 123,000 doses. And so that's about 20% of our population already right there. And we are right up there in one of the top for similar sized counties in giving vaccines. And so I think we're roughly 20% of our population, and we're at the top of similar sized counties. So we're doing really good. And that's why it's important that the state look at that too, because we're doing a really good job vaccinating here. Even though we're not getting enough, we're doing a good job with what we have because we have the capacity, Rafael, to vaccinate 21,000 people a week. A week, and we're only getting like 7 to 8,000 doses a week. Yeah, so that's a big difference. So we have the ability, but we're not getting enough doses. So that's what our hope is, that we continue to get more and more doses, because we have already opened it up to the 65 and over population. And then this week we also started with restaurant and store workers, grocery store workers. So that adds more people. And I know there's not a lot of appointments, a lot of frustration because not a lot of appointments, because we had issues with getting enough doses. And so some of our partners stopped taking first appointments because they had to catch up on the second doses, and they weren't sure how many more doses they would get, moving forward. And then there's some other changes coming soon too.
And can we focus for a second on the issue
Mhm.
of equity? We know that the members of the Latinx community
Mhm.
tend to get sicker with COVID because many of them work in the fields or work in
Mhm.
restaurants or
Mhm.
grocery stores or others essential work.
Mhm.
So the population of the Latinx community is about 27% in Sonoma County, yet about 62% of the cases at some
Mhm.
point were in the Latinx community. What about the vaccine? How is this looking to make sure that we are doing an equitable, process for
Mhm.
the community to get the vaccine?
Yes. Initially, Rafael, when you looked at the number of vaccinations that were happening, when you looked at the percentage of vaccination in the Latin community compared to other communities, it seemed pretty low. But we kind of think that that could have been because we started off with healthcare workers in the beginning. Remember, we started off with a whole group of healthcare workers and the hospital systems and everybody. So we think that the population of those workers were a little different. And so that's why our numbers look a little off to begin with. But I think now they'll be leveling off where there's more, because here in Sonoma County, even though we have been vaccinating by age, we also are looking at equity and looking at groups in our community that we need to kind of set aside vaccine. And through our clinics, through special testing sites, we've been trying to really reach our communities, because we know, like you said, that our Latin communities is mostly affected by having strong effects of when you get COVID. They have a lot of effects and even and death in our communities. So we really have been focusing on carving out space to really provide for equity vaccinations. We started with promotoras, and and then we started a few weeks ago with farm workers, and then this week with food and restaurant, grocery store, and restaurant workers, which we know there's a big population of essential workers there that are Latinx as well. So we're doing the best that we can within our means, and the doses that we get, to carve out and try to also apply equity in the administration of the vaccine.
Definitely. And then
Mhm.
what can you tell us about this new contract that the state of California
Mhm.
has, made in regards to a
Uh-huh.
third party agency that will take
Mhm.
over vaccination?
Yeah, so the state contracted with the third party administrator, which is Blue Shield. So Blue Shield is going to be handling the distribution and administration of the vaccine. So we will still have, they'll still be working with our local clinics and our hospital systems, but they will be kind of controlling that part of it. Where in the beginning of the county, we had that, so we were able to kind of distribute to our clinics and special sites that we had, the fairgrounds and different locations that we had. So we're able to do that. But now Blue Shield is we're continuing to meet with Blue Shield locally here because we hope that they continue, especially to apply equity to the distribution of the vaccine. And they have said that they will, but we kind of have to continue to wait and see see how that works. But we are meeting with them on a regular basis. This will start on March 7th, so a lot will change. And the metrics, they're saying the metrics and data will be better because they will have control of the whole data and metric system countywide because they'll be administering it and distributing it, so they say that we'll have better metrics. So I'm hoping that that's the case. And so March 7th is a date that starts. And they also will have a whole different sign up for them as well. Myturn.ca.gov. And people can go on there now and sign up now so that when their turn comes, they will be notified locally to sign up to get their vaccine. And so what they're saying, Blue Shield is in our conversations, it's going to be honoring existing appointments that we have right now through all of our different providers that we're doing the vaccination is what we're learning. So that's something that's happening March 7th. So, we're working with them to make sure it's a smooth transition.
Definitely. And so again, I appreciate all of that. And you mentioned this website of myturn.ca.gov. But what happens to our visually impaired or elderly or somebody who simply just doesn't have good internet access? How can they get information? How can they sign up for the vaccine?
Now, Blue Shield has said that they're going to have, in Myturn, like a call center, and that call center is going to have multiple languages, including Spanish. And so that's our understanding. We don't have that, but at the same time, at the county, we want to provide that type of support. So we're working with our staffing to see how we can come up with some type of a line that people can call for support, and then we can kind of on the backside work with Blue Shield or with Myturn to try to help people. But at the same time, we also are working with our local organizations and our clinics to kind of help still provide that kind of assistance to our populations, especially our at-risk communities. So we're not sure exactly how it's going to work, but we're continuing conversations with our clinics and organizations to see how we can provide that support, whether it's helping people through local trusted messengers to help them, help individuals to sign up in at-risk communities, or clinics, or maybe having sites at clinics where people can go there and can help at-risk communities sign up. So we're trying to work to determine what our plan is going to be to help, but we're going to be right there with the community every step of the way.
Definitely, that's important. And then what about the individuals who, again, maybe lost their jobs, they're low income, or simply, again, maybe visually impaired, and they need to get to their vaccine, to their appointments, and they don't have a ride, and they're not going to be able to pay $10 and $15 and $20 to get there. How is the county system, the city system, the bus system supporting this?
Yes, it's great news. So our Sonoma County Transit agencies are offering free rides to our vaccine clinics. So if you have an appointment and you need a ride to get there, all you need to do is just show proof that you have an appointment, and then they can give you a ride and even take you to the transit mall if you need a shuttle to take you to some of the vaccination sites. So they will be doing that. So that includes it's for a limited time. So they're going to be offering shuttles between the transit mall and the fairgrounds, where they're offering some of the vaccines at the Grace Pavilion. But you can use either it's good on Sonoma County Transit, the Santa Rosa City Bus, Petaluma Transit, and also their paratransit services that they offer as well. So that's all available, and all they have to do is show documentation on their phone or some documentation that they have an appointment that day.
And then last but not least, can we talk about school reopening? I'm not sure what information you have today. I know that in the past you've spoken about the governor's agreement, I guess, that some of the K-6 could open. I don't know what information you may have.
Yeah, so there's the California Safe School Plan, Safe Schools for All plan allows Sonoma County to serve pre-K to 6th grade right now. So there's a lot of applications that have been received, and what happens is that we have to still maintain our daily case rate below 25 per 100,000. And we're under that rate, which is good, but we have to maintain that. And also, we have to submit a plan to the state and to the county. So it's a COVID-19 safety plan that has to be approved by the state and the county, and that includes detailed testing protocols with how they're going to test staff, how they're doing contact tracing at the school, how they're going to handle logistic for drop off and pick up, the room spacing in the rooms, air ventilation, and so many other safety things that they have to plan for. So once they are approved, once they're approved, the plan, then, and we're under the 25 for 5 days, and the schools can reopen, and pre-K, the TK to 6th grade. And then once we move into the red tier, and we're in the red tier for 5 days, and then the schools can serve grades from all the way up to 12th grade at that point. So there's a lot of the schools in the district, and schools have submitted their plans, and there's lists. I don't have the list with me exactly right now, but there's a list of all the schools that have submitted plan. Some have been approved, some of the smaller schools have been approved, and some of them are under review right now. So hopefully there's more information coming soon on whether they have been approved and when they can be approved for opening. So there's also some timelines where they have, once it's approved, they have to be posted online for 5 days. So you'll be hearing more information about what schools have been approved to open soon on that.
And again, I want to thank you. You're taking the time every week for multiple, for many months now, to be here with us, to provide us with the latest in at least 2 languages. And I'm grateful for that opportunity that you give us to share that information with the community. So I want to thank you. I've taken more than enough of your time today, and I look forward to our next conversation.
Of course. Thank you, Rafael. Have a good evening. Thank you.
You too. Take care.